Hello, friends. Hope you are all in good health and Happy New Year 2024. So, today I am going to be talking about the process of evaluation for kidney transplant. So, before the kidney transplant is approved and a patient is placed on the UNOS, which is the United Network of Organ Sharing, for approval in order to get a donor, or if you have a living donor, the hospital where you will be having the transplant done will conduct thorough evaluation, both medical and otherwise. So I'm just going to quickly go through the steps that this evaluation would follow. So first of all, the potential kidney transplant recipient will undergo a transplant education class. It's simply an overview of the transplant process, the donor information, how to get a donor, either a living donor, a deceased donor, overview of the surgery, and any resources that you could require. Or also, if you have any questions, they will provide a number where you could reach out to ask any questions or reach out to your pre-transplant coordinator. And this transplant class could be online or it could be in person. So the next thing you would also do, at least in the US, is a financial consult with the insurance coordinator at the hospital. So this is basically checking the type of health insurance that you have to make sure it's able to cover for the transplant surgery, which is expensive. So just to check your health insurance coverage, and also that insurance will cover the anti-rejection meds that you will need post-transplant. So as part of the pre-transplant evaluation for the kidney transplant, you will also have a social work consult. So social work here is in the US is kind of like a counselor, but then they also have resources on hand. So they help patients that go through the hospital and also their family members with whatever concern they have. So they could provide therapy, and then they can also provide hands-on help in terms of resources. Maybe if you need referrals somewhere, or just to better your quality of life, someone to talk to as a starting point. Social workers are a good point of contact for that. So at every hospital, they will have a social worker. So as part of the transplant process, you will meet with the social worker, and they would evaluate your mental wellness, just to kind of see where your head is at, that you understand what you're about to embark on. You understand the transplant process and your responsibilities that will be required of you, and the aftercare, like, taking your meds, everything that is involved with that. They will also outline a plan for support after the transplant. So what that means is you need to have a um, family member, spouse, friend, someone that will be there to help you through healing post surgery. So um, they wouldn't um, they wouldn't proceed with approving the transplant if you don't have someone on hand that will check on you or be with you post transplant, because they are really strict guidelines. You will need help, basically. So they will make sure that you have a care plan in place before approving you for transplant. So let's move on to the medical side of the evaluation. So you will have testing that includes blood tests. So that will be taking blood for labs, and they will test for like a whole lot of things in the body. So just blood tests will be ordered, a slew of blood tests. You will have a chest x-ray, just to check on your chest region, your lungs, the health of the lungs, and your upper cavity. You will have an EKG, which is an electrocardiogram, just to check for any existing heart conditions or anything like that. You will also have a dental panorex, which is basically a dental x-ray. And this x-ray is of the upper and lower jaws, and also your teeth, just to check, the condition of your teeth, checking for any existing or pre-existing conditions, because the whole purpose of this is to make sure you are healthy enough for the transplant, and then you have a high rate of success after the transplant. Then the next thing you also have a CT, which is called computed tomography. That's what the CT stands for. And you have a CT of your abdomen and your pelvis just to check that area and ensure that your body has enough space for the transplanted kidney that will be put in there. Um, you will also have a treadmill stress echo test. So this has to do with the heart. And what it does is you will be on a treadmill and under supervision, and they will increase the speed. There is a routine that they go through in order to stress the heart. Um, this is just to evaluate how your heart responds and how it will hold up during surgery. Because during surgery, there's going to be a lot of stress on the heart, with the anesthesia, the blood pumping, and all that. So they want to make sure that your heart can hold up under surgery. If you are unable to, for whatever reason, get on the treadmill and physically undergo like the exercise, they could give you some drugs that will elevate your heart rate, and they could carry out the test that way too. Then you will also have a physical interview with the physician in nephrology, which is a doctor, a specialist in anything kidney. So he or she will give you a full physical, evaluate your overall health, assess your capacity to undergo this major surgery like a transplant. They just want to make sure that apart from the kidney disease, you have a high chance of survival, and then that the kidney has a high rate of um, it has a high rate of success, basically, because these organs are hard to come by. So they want to make sure they are giving it to people who have the highest chance of survival and also making use of that kidney, basically. So these are some of the evaluations that you will go through pre-transplant. And if for whatever reason they see something that they want you to go for, they can have you do additional tests. One thing I want to add also, I'm not sure if they do this for men, but for women, you also are required to go to the gynecologist just to check that everything is okay, you're not pregnant. They will have a pap smear, they require a pap smear just to make sure they check your reproductive organs, your uterus, your cervix, all that, and make sure you have a clean bill of health from the gynecologist. So that's also one of the um, that is also part of the evaluation process for kidney transplant. So I think I have that covered. It's it sounds short, but this test, of course, will take place over a course of maybe multiple appointments. They may schedule a whole day of testing, and then you have a separate day to do maybe the social work, or you could have the financial coordinator call you over the phone. But most of these, of course, are in person, just based on the type of testing and the access that they would need to complete this test. So if you have any questions about the evaluation process, please leave it in the comment section and I will try my best to respond. Thank you for listening, and I will see you in my next video. Bye.